Hello everybody, this is Dr. Medicine RX and in today's video we'll be learning about Nikolsky and other related sign. So eliciting this sign is a crucial part of blister examination, and in today's video we'll be learning about Nikolsky, modified Nikolsky, false Nikolsky, pseudo Nikolsky and bulla spread sign. So Nikolsky sign, it is usually seen in intraepidermal blistering disorders where there is loss of desmosomes. So these desmosomes are interconnecting junctions present between two epidermal keratinocytes. You elicit this sign over blisters or over normal looking skin and also over intact oral mucosa. You start by applying lateral pressure over the blister with thumb or any other finger pad, and the blisters located at a bony prominence are usually selected. The response is seen in the form of bursting of the blister, and there is dislodgement of upper layers of epidermis from the lower layers of epidermis. And this is followed by erosion formation. So there is another thing called as Nikolsky phenomenon, where instead of erosion, after eliciting the sign, a blister forms. In addition to thumb or any other finger pad, rubber or an eraser or any other blunt object can be used for eliciting the sign. In addition to these, cotton tip swab can also be used for eliciting the sign over oral mucosa. This sign is positive in pemphigus vulgaris, pemphigus foliaceus and staphylococcal scarlet skin syndrome. Now if you try to elicit this sign over normal skin, it leads to two other variants known as direct Nikolsky or marginal Nikolsky sign. So direct Nikolsky sign is seen when you try to elicit this sign at a normal looking skin at a site distant from the site of the blisters. However, if you are trying to elicit this sign at a normal looking skin which is closer to the already existing blisters, then it is called as marginal Nikolsky sign. So what is the importance of Nikolsky sign? Nikolsky sign is positive in active or progressive disease, and it is negative whenever you start the immunosuppressive therapy. However, if it reappears, then it means that the disease is flaring up. There is another importance to direct Nikolsky sign, where presence of this sign indicates that the disease is severe. However, it is the first sign to disappear after starting immunosuppressive therapy, and disappearance of this sign indicates that the acute stage of the disease has also ended. There is another two variants known as wet and dry Nikolsky sign, which is basically self-explanatory. If the erosion formed after eliciting the Nikolsky sign is moist and descending, then it is called as wet Nikolsky, and if it is dry, it is known as dry Nikolsky. Then there is another variant called as modified Nikolsky sign. It is simply the peripheral extension of blisters on applying pressure to the surface. This is helpful in patients in whom new vesicle or bulla is not available for biopsy. Then there is another variant called as false Nikolsky sign. It is also known as Sheklokov's sign. It is seen in subepidermal blistering disorders such as bullous pemphigoid, cicatricial pemphigoid, dermatitis herpetiformis, linear IgA disease, epidermolysis bullosa acquista, or even bullous SLE. It is simply the extension of erosion onto surrounding normal skin when you try to pull the peripheral remnant of roof of a ruptured blister. And it is false because it is seen in subepidermal blistering disorders rather than intraepidermal blistering disorders. And the erosions thus formed after eliciting this sign are limited in size, and there is no further extension, and they heal rapidly. There is another variant called as pseudo Nikolsky sign. It is seen in Stevens-Johnson syndrome, toxic epidermal necrolysis, and in some cases of burns and bullous ichthyosiform erythroderma. The method and mechanism of eliciting this sign is similar to that of Nikolsky sign. However, it can be elicited only on the involved or erythematous areas, and it is because of necrosis of the epidermal cells and not due to acantholysis as in the intraepidermal blistering disorders. It is also known as epidermal peeling sign. Then this is another sign called as bulla spread sign or lutz sign. Here, first of all, you mark the margins of an intact bulla with a pen, and then you apply unidirectional pressure. This leads to the peripheral extension of the bulla beyond the marked margin. So if this extension is regular and rounded, then it indicates subepidermal blistering disorder such as bullous pemphigoid. However, if it is irregular and angulated, it indicates intraepidermal blistering disorder such as pemphigus vulgaris. So bulla spread sign, it is positive in all pemphigus variants: bullous pemphigoid, dermatitis herpetiformis, epidermolysis bullosa acquista, cicatricial pemphigoid, dystrophic epidermolysis bullosa, and Stevens-Johnson and toxic epidermal necrolysis. So there is another variant called as asboe hensen sign. It is a variant of the bulla spread sign. The bulla selected in this sign are smaller and more intact and more tense. And instead of applying pressure in any unidirectional direction, here you apply the pressure towards the center of the blister.